Hello, ladies and gentlemen. Today, I want to talk directly to the warriors among us, those who have lived through decades of change, challenge, and growth. If you're over 70 and preparing for surgery or supporting someone who is, let me tell you something, age does not define your strength. But preparation does. Surgery is not just a physical journey, it's a mental one too. And while it's normal to feel nervous, especially with age, the truth is you can absolutely recover faster and avoid complications. The key, knowing what steps to take before you even step into that hospital room. When you're over 70 and preparing for surgery, the way you treat your body before the operation can make all the difference between a difficult recovery and a smooth one. The truth is, your body is still capable of remarkable healing, but it needs the right fuel and care to perform at its best. Think of surgery as an event you're training for, not something that just happens to you. Just like an athlete doesn't show up to a race without preparing, you shouldn't go into surgery without building your strength and resilience. Start with nutrition. Your body will need to rebuild tissue, fight inflammation, and resist infection after surgery, and it can't do that without the right nutrients. Lean protein, healthy fats, fruits and vegetables rich in vitamins like C and E, these aren't just good for you, they are essential. You're not eating for pleasure now, you're eating for purpose. This is your fuel, your medicine, your advantage. Hydration is just as vital. Many older adults go into surgery already dehydrated, which can increase the risk of confusion, blood pressure drops, and longer recovery times. Get into the habit now of drinking enough water every day. That simple step alone can help you avoid complications that might seem unrelated, but are directly linked to how well your body is functioning. Don't underestimate the power of movement. Even light daily walking or stretching before surgery can help you maintain strength and flexibility that will make getting out of bed afterward easier. It keeps your circulation active and supports lung function, both of which play a big role in preventing clots and pneumonia post-surgery. If you can safely exercise under the guidance of your doctor or a physical therapist, it's one of the best investments you can make in your own recovery. Sleep is also a powerful healer. Chronic poor sleep weakens the immune system and slows wound healing. Start creating a healthy bedtime routine. Now limit caffeine, avoid screens before bed, and create a quiet, restful space. Think of each good night's sleep as another deposit into your healing bank. Preparation is not just about the physical. It's about building momentum and believing in your ability to shape your own outcome. You're not at the mercy of fate. You're in charge, and every good choice you make now is one step closer to waking up stronger and healing faster. There is something else just as important: your medications. At 70 and beyond, it's likely that you're taking a few daily prescriptions, maybe for blood pressure, diabetes, heart health, or arthritis. Every single one of those medications interacts with your body, and during surgery, they can interact with anesthesia or other drugs you're given. Some blood thinners, for example, can dramatically increase the risk of bleeding. Certain supplements that seem harmless, like ginkgo or fish oil, can do the same. Diuretics can cause dangerous drops in blood pressure during anesthesia. Pain medications or sedatives might interfere with memory and cognition after surgery, leading to confusion or even falls. This is not about fear. This is about taking responsibility. Make a complete list of everything you're taking: prescriptions, vitamins, herbal supplements, even over-the-counter items. Take that list to your surgeon, your anesthesiologist, your pharmacist. Ask questions. Get clarity. Don't assume the system will catch everything. You are the system. Being informed doesn't make you a burden, it makes you a partner in your own care. When you take the lead in understanding your medications, you reduce your risks dramatically. You create space for a safer surgery and a smoother recovery, and in doing so, you send a powerful message to everyone around you that you are not passive in your own health. You are informed, engaged, and unafraid to do the work. That mindset is part of your medicine too. It's part of what keeps you safe, strong, and moving forward. Our body can only go where your mind is willing to lead. At any age, and especially after 70, the mental game is just as important as the physical. Surgery is more than a medical event. It's a challenge that requires calm, clarity, and courage. What many people don't realize is that your attitude before surgery has a direct impact on how you recover afterward. When you approach surgery with a mindset of fear, panic, or hopelessness, your body internalizes that stress. Stress raises inflammation, weakens the immune system, disrupts sleep, and slows healing. But when you choose to face surgery with confidence, preparation, and focus, your body takes that as a cue to begin healing before the first incision is ever made. You have the power to shape that mindset. One of the best tools is mindfulness, learning to breathe deeply, to stay present, and to focus on what you can control. That builds emotional strength. Whether it's meditation, prayer, journaling, or even listening to calming music each day, every small habit creates space in your mind for peace. That peace becomes your anchor. It becomes the foundation from which strength grows. People who stay mentally grounded and optimistic tend to experience less post-surgical pain, shorter hospital stays, and fewer complications. That's not magic. That's mindset in action. Don't let your age fool you. You're not more fragile mentally, you're more experienced. You've handled life's storms. You've had losses, wins, setbacks, and comebacks. You know how to get through hard things. This is another one. It's okay to acknowledge fear, but don't let it lead. Talk to others who have been through the same type of surgery. Ask your doctor questions until you feel fully informed. Knowledge kills fear. Confidence builds with clarity. And when you show up for that procedure with a clear mind and a focused heart, your recovery becomes a mission you're already winning. Recovery doesn't happen in a vacuum. It doesn't happen just because the doctor says it will. It happens because you're surrounded by the right people at the right time, doing the right things. Planning your post-surgery support system is one of the smartest and most loving things you can do for yourself and for your loved ones. After surgery, even small tasks like standing up, preparing meals, or remembering your medication schedule can feel overwhelming. That's normal. What's not normal is trying to do it alone. Start now. Identify who can help you in the first few days and weeks after your procedure. This might be a spouse, a family member, a friend, or even a professional caregiver. Talk to them. Set expectations. Make sure someone can be there to take you home, help you bathe, walk, or just keep you company as your body regains its strength. If you live alone, you may need to arrange extra help, even temporarily. You're not being a burden, you're being wise. Asking for support doesn't make you weak. It makes you human, and healing is one of the most human things we ever do. Beyond just physical help, you also need someone to help communicate with your healthcare team if you're not feeling 100%. After surgery, medications or grogginess might affect your memory or ability to think clearly. Having someone with you who can ask the right questions, write down instructions, or notice signs of infection or confusion is a powerful layer of protection. Think of this person as your second set of eyes and ears. You deserve that kind of safety net. The truth is, no matter how old you are, healing is a team sport. It's not about pride, it's about progress. By setting up your support system in advance, you're giving yourself the best possible chance at a full and safe recovery. You are showing yourself love, leadership, and wisdom. That's the mindset of someone who's not just hoping to heal, but planning to. One of the most powerful things you can do before surgery after the age of 70 is to ask for a geriatric assessment. It may sound complicated or unfamiliar, but it's actually one of the most insightful tools available to help you and your doctors create the safest, most effective plan for your surgery and recovery. A geriatric assessment isn't just a checkup. It's a comprehensive evaluation that looks at more than your vital signs. It looks at your mobility, your memory, your emotional well-being, your nutrition, your medications, your social support, and even your ability to carry out daily activities like dressing, bathing, and preparing meals. This type of assessment can reveal subtle risks that might otherwise go unnoticed in a routine exam. Maybe your balance is slightly off, or your memory is slipping a little more than expected. Maybe a medication you've been taking for years is now affecting your blood pressure or your alertness. These are things that could affect your ability to recover safely. The beauty of this assessment is that it catches those things before they become complications. It gives your surgeon, your anesthesiologist, and your entire care team the information they need to adjust their approach specifically for you. You are not just another patient on the schedule. You are an individual with a history, with needs, with strengths that matter. The geriatric assessment honors that. It says, let's not guess, let's know. And when you know, you can make better decisions. You can ask better questions. You can speak up for yourself with confidence because you've seen the full picture. That kind of awareness is not a luxury, it's a form of power. Some people avoid this type of assessment because they fear what it might uncover. But knowledge is never your enemy, it's your ally. What you discover now could protect you from infections, falls, confusion, or extended hospital stays later. This is about being proactive. This is about owning your health and refusing to leave anything to chance. You've lived long enough to know that things go better when you prepare for them. This is no different. Preparation doesn't just increase your safety, it increases your peace of mind. It allows you to go into surgery knowing that every angle has been considered and that your care is truly tailored to your needs. There's a belief that after a certain age, you just have to accept what comes. But that belief is a myth. Age is not the enemy. It is not the reason to fear surgery or to expect a hard recovery. What makes the biggest difference is not the number on your birth certificate, it's your level of preparation. It's the decisions you make and the actions you take before you even walk into that hospital room. You are not too old to recover well. You are not too late to make changes. You are not too far gone to take control of your health. Every step you take to prepare, every walk you go on, every medication you review, every question you ask, every person you involve in your support system is an act of strength. That strength is not diminished by age. It's defined by it. You have lived through things younger people can't imagine. You've solved problems. You've made hard choices. You've earned wisdom, and now you get to use it. Surgery after 70 isn't a gamble if you're prepared. It's a challenge that you are fully capable of meeting. And when you do, when you walk into that recovery with intention, with knowledge, with support, and with courage, you send a message to the world and to yourself. That message is this: I am not finished. I am not fragile. I am ready. So remember, this surgery after 70 isn't about fear. It's about strategy, strength, and self-respect. You've come this far in life by overcoming obstacles. This is just another mountain to climb, and you are fully capable of reaching the summit. Prepare your body, sharpen your mind, rally your support. You've got this. You're not too old. You're experienced, wise, and ready. Recovery doesn't just happen. You make it happen. Let's go forward with courage and come out stronger than ever. Thank you.